Alright, hi guys, a very good evening to all of you. Welcome to today's YouTube session. Once again on the same topic that we have been doing on Sundays, that is fun with pharma, where you will be identifying the name of a drug using the smileys, and I'll be giving you some important salient feature about those drugs, and we can proceed accordingly. Do remember a quick disclaimer that I would like to give, that these are not any type of MCQ that can be asked or is been asked in the past in any examination. This is just a fun filled session, fun yet informative session for all of you guys, just to keep your interest in the subject. We are coming up usually on the Sundays, so it's like a therapy, a relaxation through the pharmacology. Okay, so let's start this session very quickly. But before that, can you guys let me know if I'm clearly audible and visible to all of you guys? If the audio and video both are fine, please reply in this comment section. For all the students, those who are new, you can actually use the live chat section here and you can reply to the comments. All fine? All right. Okay. So a couple of announcements about certain batches that has been started recently, and the code that you have, that is one of the code that we all know, is known as your Dr Siraj Live, or the other code which is also active is Pharma 10. Either of the code you can use. Pharma 10, Dr Siraj Live, they are all together, ये साथ में ही है सब कुछ, और Pharma 10, both of the codes are active. You can use this to buy a plus subscription. You can also use it to in buying iconic subscription, where you can avail all the benefits of the Unacademy and Prep Ladder together. Remember, you can also use the same code, right, for unlocking multiple courses, free courses on the platform. Okay, some of the batches: Mission INICT 2022. So this is actually started on March 9 and already about to finish in May 9. This is an old batch course actually. This has also started. MCQ Marathon batch course. Focus FMGE, a batch that has also been started, and this is also something that has been done. Okay, in this one you can buy, these are the cost of the different subscription costs that we have. And in addition to everything that we have, I think you can use the same code that I have told you, Pharma 10. All right. Okay, so a couple of rules that we are having, like for example, this is the one rule, one example that I give in all the Fun with Pharma series. Like for example, if you see, there's a prime and then there's a queen. So collectively this will be prima queen. So I can ask any particular question about this, like what is the mechanism of action of shown drug, or what is one of the important ADR of the shown drug, है ना? So this type of information, this type of question can be asked. So this is one of the example, है ना? इस तरह से I'll be giving you certain name of the drugs, and then you have to I guess. Disclaimer once again, this is not the type of question that you will be seeing in your examination. This is just a fun filled session, just to relax you from all the stressful information that is going. But believe me, it will be informative as well. You will end up revising some or the other information. Okay, so right now I'm showing you one. Let's get started. And I'm giving you one smiley here, a combination of 3 smiley here actually. Identify the drug and its use. How is it being used, or its mechanism of action, I would say, is a much better term. It's a beta 3 antagonist, alpha 1 receptor antagonist, beta 3 receptor agonist, and alpha 1 receptor agonist. Go ahead please, Archie Gupta. So if you can see, there is someone beside, behind there is image of a lord. If you can see here, then there's someone is begging and someone is running. So if you collect them all together, go ahead please, all of you. Very well, I think all of you are getting it already. The name of the agent is there is a Mira, then he's begging over here, so that is your beg, and that is run. Mirabegron, it's actually Mirabegron. So this Mirabegron कहाँ पे use करेंगे, जल्दी से mechanism of action बता दिए, short information. It's actually a beta 3 receptor agonist, right, that is going to relax the bladder. It will be causing relaxation of the bladder, and relaxation of the bladder will be utilized in which scenario? Relaxation of the bladder will be utilized in which scenario? Go ahead please. कहाँ पे यूज करेंगे? इट कैन बी यूज इन ओवर एक्टिव ब्लैडर, और वी कैन ऑल्सो यूज इट फॉर द stress incontinence, overactive bladder stress incontinence, right? Similar to this, the other class of drug that you can also use will be M3 antagonist like derifenacin. Okay, derifenacin. So this is actually beta 3 receptor agonist. All right, so quickly we will be seeing similar smileys like this. So I hope the rule is quite clear, and you have to just guess, थोड़ा सा guess करिए, it will just trickle your brain and it will come out. So हमने क्या पढ़ा यहाँ पे? Mirabegron. बीटा 3 पे एक न्यू ड्रग अभी आया है जिसका नाम है Vibegron, है ना, Vibegron. So you also have read one more thing. Vibegron is also a beta 3 receptor agonist used for the same scenario, overactive bladder stress incontinence. Okay, now I want you to see this. Identify the drug and its use. So this information, these options are very easy. All you have to identify. What is difficult little is you have to collect all of them together. So what you can see here, there is a tie, and there is one image again. Then there is a rope, and there is a plant that is giving us opioid. A plant that is giving us opioid. Very good. Some of you are already coming up. Furkan, Eshwar. So how did you come up with? See, there is a tie, OT, then there is a rope here, and there is a opium here, right? Opium. So what is coming? You know what is coming it all together? It is coming together as a tiotropium. Tiotropium. Yes or no? Tiotropium. It is one of the beta 3 agonists. What is tiotropium? It is actually M3 antagonist. It's a passive kind of bronchodilator, passive or indirect kind of bronchodilator. Along with that, they also decrease the secretion. Do remember, it is considered as a drug of choice in COPD. Moreover, it can also be used in bronchial asthma. It can be used in bronchial asthma, but drug of choice in COPD. So D is the correct answer, right? It is not used in hypertension, arrhythmia, or any other area. So a little bit of, you know, a jumbling of these smileys or the images that we are having. You just have to collect them all together and just tell them. Okay, what is the important side effect? It has been asked in one of the examination. It's an anticholinergic drug, so it can cause blurring of vision, it can cause dryness of mouth. It's an anticholinergic drug. Can it cause urine retention? Yes, urine retention. 2016 FMGE का direct question है ये. Tiotropium drug देके side effect पूछा, ठीक है. Then it can even cause throat irritation given by the inhalational route. So throat irritation, है ना, throat irritation is another side effect. Blurring of vision, dry mouth, urine irritation. So in a nutshell, it's an anticholinergic drug, so anticholinergic side effect will be seen. Next one. So identify the drug. So if you can see this, these images have been actually prepared with a couple of teams. Some of my very intelligent juniors, they have come up with some of the ideas like this, and they put me as well in this. So there are many doctors, like I would like to thank Sumit, Vibhu, Dr. Vibhu, and who else? There was Hera, and many students were there, and these are some of the names that I would like to mention here. So if you can find it out, see, there is something that we like to eat, then I am here, what am I, and there is this image. Collect them all together. If you can even just put this one, then you can easily collect. ये क्या है? What is this? This image, the first image. What is the first image? Candy. Candy is the first image. My name is Dr. Siraj, or I would say I am your pharmacology faculty. Chocolate. चॉकलेट कैसे होगा? चॉकलेट कौन सा दवा है बताओ? स्टैफी, विश्वकर्मा, है ना, है ना. एंड देन देयर इज अ टैन, है ना, टैन नॉर्मल वॉच वाला एरिया, देन देयर इज अ टैन, है ना. सो देयर इज अ टैन. तो क्या हो गया? कलेक्टेड. एज आई सेड, दे आर जस्ट अ फन फील्ड सेशन, nothing so important, but what we end up revising is few important points about Candesartan. So the name of the drug that we are having is Candesartan. Important points about that this is one of the angiotensin 1 receptor antagonists, and all the angiotensin 1 receptor, they are GQ mediated. Another important point is they are having highest affinity or the maximum 81 एंजियोटेंसिन 1 से एफिनिटी इसका है. फॉर एग्जांपल इफ यू गिव let's say candesartan or losartan, candesartan will have high chances for binding with the 81 receptor. It is also one of the FDA approved drug for the prophylaxis of the migraine. Remember, it's an anti-hypertensive drug, can also be used in the migraine. So it's an anti-hypertensive drug, not used in osteoporosis, arrhythmia and all. These options are simply, you know, almost similar in almost all the question. ठीक है. So candy, sir and tan, candesartan. So I hope you guys have got this. So of course it can be used in hypertension. Angiotensin receptor blocker है. So other use that we are having, it can be used in hypertension. It can be used in heart failure. ठीक है. Angiotensin receptor blocker, they are having mortality related benefit as well. Okay. Same as ACE inhibitor. Next one. I want you to guess this one. Identify the drug and its target of action. So this is pretty simple. There is one symbol, you have to find out which symbol is that, and then there is one powder, something mentioned on the powder. Very easy, very easy. ये तो सबसे easiest है I believe. इसमें किसी को difficulty नहीं होगा. All of you please go ahead. Target of action. वेरी गुड, वेरी गुड. चलो ड्रग को तो आपने आइडेंटिफाई कर लिया, लास्ट में सिन है ना. सो आपने उससे आइडेंटिफाई कर लिया. नाउ आप एबीसीडी में बताइए व्हाट वुड बी द करेक्ट आंसर. टारगेट ऑफ एक्शन, करेक्ट आंसर पैराइटल सेल ऑफ द स्टमक, स्केलेटल मसल, नोडल टिश्यू ऑफ द हार्ट, पोटेशियम चैनल एंड कैल्शियम चैनल ब्लॉकर. व्हाट डू थिंक? So I would just quickly give you the correct answer. Name of the agent is your add हो गया और साथ में इनो भी हो गया. So adeno और पाप भी है, that is sin, adenosine, right? That will be acting on the nodal tissue of the heart. Remember, it's not a blocker of the calcium and potassium both. Calcium को block करेगा, potassium को open करेगा. So that is something that you should know. Adenosine है ना. B is the correct answer on the other hand. Okay, all the other students जो those are marking C or A, they are not acting on the parietal cell of the stomach. ठीक है. Adenosine, nodal tissue of the heart mainly. Okay, something has been mentioned here. Identify the drug and its target of action. I want you to focus here. Something has been mentioned here. I am putting a box over here. Can you guys read this? I will just write it here. Write it here once again here. Something written here, Vedas. So these are the Vedas, a couple of books that are kept. These books are Vedas. What is the name of the drug? बुसुल्फान. ये बस जैसा लग रहा है क्या? आप सब लोग जब कभी भी चैट करते हो तो आप लिखते हो LOL, लॉल, और जो स्माइली बन के आता है वो कुछ ऐसा होता है, लॉल, है ना. ये हो गया कार, साथ में है वेदास, कार, वेडी, आई एंड लॉल. सो क्या हो जाएगा? द नेम ऑफ द एजेंट इज नन अदर देन Carvedilol. 2-3 important points that I would like to tell you, that it is one of the third generation beta blocker, having beta blocking property plus additional alpha 1 blocking property as well, with alpha 1 blocking property, plus it is also नॉन सेलेक्टिव में आ गया, थर्ड जनरेशन में आ गया, है ना, कार्वेडिलॉल. ठीक है. It's the also preferred beta blocker in heart failure, or I would say chronic heart failure. They will decrease the preload. Plus they are also having free radical scavenging property. ठीक है. They also have free radical scavenging property, or I would say antioxidant property. Antioxidant property. So can they cause vasodilatation? Yes. Now this vasodilatation, is it due to nitric oxide or is it due to alpha 1 blockade? The answer is alpha 1 blockade. So beta blocker with the alpha 1 blocking property, because of which they are going to have vasodilating property. This vasodilating property, remember, is not due to nitric oxide release, it is due to the alpha 1 blocking, because you had to differentiate in one of the examination I have seen, either it was asked in any of the GTs or in one of the examination. you have to identify that this vasodilating property is due to nitric oxide release. So drugs like nebivolol, nipradilol, celiprolol, these are the ones that release nitric oxide. They can cause vasodilatation, but carvedilol vasodilatation karega due to alpha-1 blocking. So where do we use it? Is it used in osteoporosis, hypertension? It's an anti-arrhythmic drug. It's an anti-obesity drug. Yes. So if you see, it's a second line anti-hypertensive drug. Beta blocker is second line anti-hypertensive भी होगा, right? Second line anti-hypertensive. Arrhythmia में भी use करेंगे. Why? Because the beta blockers that we are having, the beta blockers are coming under the class 2 anti-arrhythmic drug. Now you have to identify a very important point. Because they are vasodilating property, any vasodilator, they will cause fall in the blood pressure and they can induce reflex tachycardia. वो problem है ना, reflex tachycardia. तो इसलिए third generations are not very commonly preferred as an anti-arrhythmic drug. Anti-arrhythmic drug में as an anti-arrhythmic drug that we use, mainly we are going to use the cardio-selective beta blockers. Cardio-selective beta blockers are the mainly used. The drugs that are mainly used. So I would say here that we can go ahead with the B more than C. And B more than C. There could be two answers here. B is more than C. Okay. So these options are not very important, but you just have to identify the name of the drugs. Okay. You have to use a little bit of Hindi term here. True about the given agent. Can you identify the brave person here in this image who invaded the neighboring country? True about the given drug. Flufenazine. तो फ्लू कैसे हुआ? फेना तो समझ में आ रहा है, जीन कैसे हुआ? I hope all of you guys remember him. You cannot forget him. The bravest soldier India has seen so far. I mean आज के एरा में. इस पे तो सीजन 2 में भी we had one drug. So थोड़ा बहुत हिंदी आपको यूज करना पड़ेगा. This is actually a hand pump, है ना? Hand pump है. So this is actually a null, है ना? Hand, मैंने बोला था कि हिंदी में थोड़ा सा यूज करना पड़ेगा. फिना एंड दिस इज और वीर. ये वीर है तो हिंदी वर्ड थोड़ा सा यूज करना पड़ा आपको. दिस इज एक्चुअली नेल्फिनावीर. व्हाट इज द इंपॉर्टेंट पॉइंट दैट यू शुड नो अबाउट नेल्फिनावीर? इट इज वन ऑफ द protease inhibitors that does not have drug to drug interaction. It is metabolized by non microsomal enzyme. ठीक है. They do not have enzyme inhibiting property as like other protease inhibitor. Other protease inhibitors are known enzyme inhibitor, है ना? Nelfinavir metabolized by non microsomal enzyme, therefore they do not have much drug to drug interaction. Nelfinavir. Okay. I think this one was asked in the previous as well, if I am not wrong. यहीं पे there was some problem with the internet, so I have repeated this question again. Identify the drug and its use. So there is a bird. Just identify. There is a bird. What is the name of the bird? The lovebirds. Very good. Dove, है ना? Dove are the phenbutamine. Phenbutamine कुछ होता है कि नहीं, पहले तो मुझे ये चेक करना पड़ेगा, है ना? फेन कैसे होगा ये तो बर्ड है, डॉव बर्ड है ना? सो दिस इज डॉव बर्ड. सो दिस इज डॉव. द नेम ऑफ द एजेंट आई एम trying to ask it, dobutamine. Dove, there's a boot and there's a mine, dobutamine. So that will be mainly used in which scenario? Dobutamine is a selective beta 1 agonist. Selective beta 1 agonist कहाँ पे यूज करेंगे? It will be preferred in a patient with acute heart failure, है ना? Also can be preferred drug in a patient with a cardiogenic shock. ठीक है. So heart failure will be the most important, because hypertension could not be a correct answer because they themselves are beta 1. So tachycardia करेंगे. Antiarrhythmic drug, they themselves are going to induce the arrhythmia or increase the heart rate. Obesity में का कोई इसका there is no such report like it is an anti-obesity drug. Okay, yes, it is also used as a stress test, है ना, for the stress test. For example, in let's say morbid obese patient or some patient, those who are having amputated legs, those who cannot walk on the treadmill, है ना, so treadmill पे जो नहीं चल सकते ऐसे patient के लिए we can use it for the as a stress test. So you will be IV, you will be injecting this drug and you will be doing the echo. So stress test for the echocardiography, echo in any morbid obese patient or diabetic foot ulcer or amputated patient, उसमें use कर सकते हैं. Okay, so identify the drug and its target of action. Very easy. It's an antiretroviral, it's antibacterial, antiarrhythmic, anti-cancer. What is this? Someone is crying, someone is happy because they have won something, and then there is a box. What is the name? Very good. So he has, there's a winning scenario, crying scenario, and then there's a tin. So क्या हो जाएगा? Very good, Vincristine. Now what do you know about Vincristine? Important points. कौन से फेज में काम करता है? It's a M phase inhibitor. Vincristine is a M phase inhibitor. Very good. And remember, it is one of the drugs that is having marrow sparing property. Marrow sparing property. ठीक है? It is used in multiple conditions, है ना? Multiple condition. Hodgkin's lymphoma, non-Hodgkin lymphoma, है ना? टिनोफेनावीर, मयंक, टिनोफेनावीर कैसे होगा बताओ? ये विन कर रहा है, ये क्राई कर रहा है और ये रो रहा है, ये देयर इज अ टिन, है ना? सो दिस इज एन एंटी कैंसर ड्रग. विनक्रिस्टिन, अ मैरो स्पेयरिंग एंटी कैंसर ड्रग, है ना? यूज्ड इन मल्टीपल कंडीशन, है ना? यूज्ड इन मल्टीपल, जैसे अगर मैं बोलूं ABVD रेजिमेन, है ना, हॉजकिंस लिम्फोमा में वी कैन यूज वेरी वेरी कॉमनली, है ना? Their side effect is also important, has been asked. SIADH. It can also cause peripheral neuropathy. Vincristine along with the other side effect like nausea, vomiting, bone marrow suppression. Bone marrow suppression तो ये नहीं करता, ये marrow sparing है, so ये important है. ठीक है, Vincristine. Okay. Identify this. So there is one image, one smiley that is taken from the phone itself. One of the lords in Hindu mythology. Identify the drug in its use. Sorry, Hindu religion, Hinduism, one of the lords, and then there is I, then someone is praying, someone has fell ill. Go ahead. I think I have already given you the correct answer. Jesus, Amuda, Mary, string D. No, identify the name of the drug. That is what you have to do. This is a fun filled session. आप इसको enjoy करिए, stress से मत रहिए. Enjoy it. I am not judging you on the basis of this. Just identify the name of the drug. बाकी सब हो जाएगा. Because these are very very easy. Everyone knows कि which this drug is used in which scenario. Yes. So there is Lord Ram. I. Someone is praying here, and someone is fall ill here. ठीक है, तो क्या होगा ये? This will be Ramipril. Very good, Ramipril. Ramipril is one of the ACE inhibitor. It's not used in HIV. It's not in obesity or epilepsy. है ना? कई लोग इसको D बोलते हैं, anti-hypertensive drug. So these options are very easy. You just have to identify the name of the drugs. Okay, Ramipril. ठीक है, ACE inhibitors. ऑलराइट, ये थोड़ा सा डिफिकल्ट होगा बट अगर आप ऐड करेंगे तो मिल जाएगा. There's a smiley giving you love, love or I would say heart. So heart हम जब भी शो करते हैं, that means we are trying to show our love. जब भी चैट करते हैं, then there's this one. tired with a tire. Listen to me, I said tired with a tire, है ना, looking at you. और लास्ट में जो है एक मैंगो है. मैंगो को हिंदी में क्या बोलते हैं वो आपको सबको पता है. व्हाट डू वी कॉल मैंगो इन हिंदी? आई थिंक सम ऑफ यू आर एक्चुअली गिवन द करेक्ट आंसर. आकाश, मैंगो इन हिंदी. डिल्टियाजेम. डिल्टियाजेम. दिल तो समझ में आ रहा है, टिया टायर चलो मान लेंगे, बट जेम कहाँ जाएगा? डिल्टियाजेम. क्लास 4 सब लोग डिल्टियाजेम क्यों बोल रहे हैं भाई? डिल्टियाजेम. डिल्टियाजेम. जेम. there's a tire. Okay, see, I would say there's a love here, tire, leve, and then there's I. The name of the drug which I would like to ask here, leve, tira, Levetiracetam. C, ICU, है ना, ICU. Then T, and then there's an arm, Levetiracetam, है ना. डिल्टियाजेम हो सकता था, लेकिन डिल्टियाजेम इतना बड़ा नहीं बनेगा. डिल टिया, है ना, टी बन जाता, डिल और टी बन जाता. सो दैट इज आई कैन इंक्लूड दैट इन द नेक्स्ट सीरीज. डिल्टियाजेम, डिल, एंड देन द टी, है ना, एंड देन आई कुड पुट लेट्स से डिल्टियाजेम. आई कैन पुट डॉक्टर आजम, है ना, द एनाटॉमी फैकल्टी. सो दैट विल बी डिल्टियाजेम. या सो वी कैन पुट दैट इन द नेक्स्ट सीरीज, next session. Okay, so here levetiracetam, what is needed to know here is it's one of the SV2A inhibitor, levetiracetam, and this is considered the drug of choice for epilepsy in pregnancy. Levetiracetam, its side effect has been asked a couple of times. It will be causing side effect like, you know, somnolence being the most common side effect, है ना. Then others that we are having, other side effect is it is going to cause aggression, anxiety, anger, ये सारे A वाले, है ना, irritability, ये सारे साइड इफेक्ट मेनली होते हैं इनके. SV2A इनहिबिटर, है ना. लेवेटिरासिटाम एक और होता है, ब्रिवारासिटाम, इसी का कॉन्जनर है. सो दिस इज एक्चुअली एन एंटी एपिलेप्टिक ड्रग. इट्स एन एंटी, एक्चुअली एंटी एपिलेप्टिक ड्रग. Okay, this is pretty simple. Identify the drug and its use. Go ahead, please. A couple of pillows here. Then there's a smiley says car, and then there's a pine tree. I think it's pretty simple. We can use, but status epilepticus का treatment का एक modality है, like है ना, benzodiazepine से start करेंगे, lorazepam. Then we can use other agents including phenytoin. Moving forward, we can even use barbiturates. Again, not responding, we can even use the general anesthetic. Yes, so this is pretty simple. There's a pillow, right? If you can see pillow, then there's a car and there's pine. ये तो बहुत आसान हो गया. So the name of the agent is pilocarpine. Two important things that you should know. It is one of the M3 receptor agonist, and any M3 receptor agonist, it causes active myosis. If a drug is causing myosis, definitely it can be used for the treatment of the glaucoma. Glaucoma में इसको यूज करेंगे. It's an M3 receptor agonist. Do remember, it is going to increase the aqueous outflow. Aqueous outflow कौन से pathway से? Via uveoscleral outflow. Via uveoscleral outflow it will increase. And pilocarpine, because it's M3 receptor, do remember M3 receptor is also present over the ciliary muscle. So one of the important side effects that we see, it causes broache or frontal headache. ये यहाँ पे broache or frontal headache will be one of the very common side effects with the pilocarpine. Remember this. Okay, it's not mydriatic, it's myotic. ठीक है, they themselves are going to cause excessive salivation, है ना. So it can be used in a patient with the, है ना, dry mouth. Xerostomia में use कर सकते हैं. It's an anti-glaucoma drug, not in the sialorrhea. Anti-glaucoma drug. Okay. So it's a myotic drug. Pilocarpine and pin. I want you to identify the next one. थोड़ा सा इसमें ऑफ्थेल्मोलॉजी का हेल्प लगेगा आपके लिए, बट इट्स प्रीटी सिंपल वन and you can easily identify the name of this drug. We are about to finish actually. Identify kariye. What do you see is the first. Semimelin is the drug of choice for Sjogren's syndrome, yes. But pilocarpine, bethanicol can also be used, Staffi. So these are the things that I am revising along with a little bit of tickling your brain. So आपने यहाँ sim देखा, there is a vas है, and then there is stye, and then there is a tin, है ना. So the name of the agent is your Simvastatin, है कि नहीं? Simvastatin, right? Simvastatin is an anti-dyslipidemic drug. What is the mechanism of action? HMG CoA reductase inhibitor. Simvastatin, it's the best drug, or I would say drug of choice to decrease LDL cholesterol. Okay, drug of choice, the best drug to decrease LDL cholesterol. Another thing that you should know is the important side effect. What is the important side effect? है ना, मायोपैथी बहुत कॉमन है, हेपेटोटॉक्सिसिटी, मैक्यूलोपैथी थोड़ा रेयर है बट कैन बी कॉज, नॉट वेरी कॉमन. मैक्यूलोपैथी वगैरह वो नायसिन से ज़्यादा होता है, ठीक है. सो दिस मायोपैथी कुड बी एज सिंपल myalgia to life threatening rhabdomyolysis. The range is simple myalgia to life threatening rhabdomyolysis, है ना. So ये होता है एंटी डिस्लिपिडेमिक. सो कैसे दिखा? सिम वास स्टाई एंड टिन, सिमवास्टेटिन. Okay, this is the last one I believe. Mechanism of action of the shown drug. पहले ड्रग का नाम आइडेंटिफाई करिए, रेस्ट थिंग बिकम वेरी वेरी इजी. So if you can see, early morning stuff that you always hold after getting out of the bed. फायर को हिंदी में क्या कहते हैं? अगर आपको पता है तो यू कैन इजीली डू. And your favorite character of the TV. Go ahead please. Guess करिए. मैंने बोला इसको हिंदी में आप देखिएगा, इसको इंग्लिश में देखिएगा. What do you call this in Hindi? Okay, very good. Amrita, you have tried very well, but थोड़ा स्पेलिंग गलत हो गया. I think I should start putting prize over this, है ना. So next वाले शो से I'll be putting some prize over this. Whoever is going to mark it ahead of time, I'll be giving some reward. Should be rewarded. It should be rewarding, है ना. So पहले ये क्या है? T है, फायर है, और जिसको हम बोलेंगे आग, और ये आपका कैरेक्टर है मिस्टर बीन. सो व्हाट दिस विल बी योर Tiagabine, ट्रांसपोर्ट इनहिबिटर ऑफ द गाबा, है ना. GAT1 इनहिबिटर, ट्रांसपोर्ट इनहिबिटर ऑफ द गाबा. गाबा रीअपटेक इनहिबिटर है. गाबा रीअपटेक इनहिबिटर, इट इज मेनली यूज्ड इन द पार्शियल और द फोकल सीजर. कहां पे नहीं देंगे? इट इज कॉन्ट्राइंडिकेटेड इन एब्सेंस सीजर. में ये कॉन्ट्राइंडिकेटेड होगा, ठीक है. Alright, so this is not potassium channel opener, it's actually GABA reuptake inhibitor, na. Tiagabine, na, GABA transport 1 inhibitor. So this is the one. Okay, one more is there. I guess all of you have seen this already in the last class as well. This was actually asked in the season 2 as well, so it's a bonus, I would say. There's a topi, then one of the lords, and then there is one number. So that's very easy to guess. Identify the drug. क्या ड्रग है? मैं एक बात बोलता हूं आपको, देयर इज वन ड्रग जो कि ये वियर करता है एंड डज ऑल द गुड वर्क. तो ये मैं बार बार बोलता हूं, ये ड्रग बहुत फेवरेट है मेरा, टोपिरामेट. कैसे? टोपी, लॉड्राम एंड 8, है ना. टोपी, राम एंड 8 सो टोपिरामेट. एंड व्हाई डू आई कॉल इट टोपीपैन के सारे अच्छे काम करने वाले ड्रग, राइट? बिकॉज इट्स वन ऑफ द एंटी एपिलेप्टिक ड्रग. टोटली एग्री. इट इज यूज फॉर द प्रोफिलैक्सिस ऑफ द माइग्रेन. सो सर दर्द भी कम करता है, टोपीपैन की हेडेक कम करता है. इट इज ऑल्सो यूज एज एन एंटी ओबेसिटी ड्रग. सो टोपीपैन के ये वेट को भी नहीं बढ़ने देगा, टोपिरामेट. और कहाँ पे यूज करते हैं टोपिरामेट को? एनीवन कैन टेल मी? एंटी एपिलेप्टिक, प्रोफिलैक्सिस ऑफ माइग्रेन, इट डिक्रीज द एल्कोहल क्रेविंग. सो टोपीपैन के एल्कोहल भी नहीं पीने देता है, एल्कोहल क्रेविंग. माइग्रेन प्रोफिलैक्सिस आई हैव रिटन हियर ऑलरेडी. देन टोपीपैन के ये बाइपोलर डिसऑर्डर में भी दे सकते हैं. इट कैन ऑल्सो बी यूज्ड इन बाइपोलर डिसऑर्डर, है ना? सो टोपीपैन के इतने सारे अच्छे काम करता है. 5 गुड थिंग्स अबाउट देम. इट इज नॉट ओनली यूज्ड इन एपिलेप्सी बट अदर यूजेस लाइक माइग्रेन, है ना, ओबेसिटी, एल्कोहल क्रेविंग, है ना, बाइपोलर डिसऑर्डर, सब में यूज करते हैं. सो दिस इज एन आउट ऑफ द गिवन वन, दिस इज द करेक्ट वन. एंटी ओबेसिटी एजेंट. इट्स एक्चुअली मेनली एन एंटी एपिलेप्टिक ड्रग, कैन बी यूज्ड फॉर द ओबेसिटी एज वेल. टोपिरामेट. Okay, guess the drug on the basis of the smiley being shown here. I think you can easily identify this. टोपी पहनता है, टोपी पहन के सारे अच्छे काम करता है. 5 अच्छे काम मैंने बताए थे. टोपी पहन के क्या क्या करता है? एपिलेप्सी, हेडेक, ठीक है, ओबेसिटी, बाइपोलर डिसऑर्डर और एल्कोहल क्रेविंग को भी कम करता है. टोपी पहन के सारे अच्छे काम करता है. गो अहेड प्लीज. सो यू कैन इजीली फाइंड. आई थिंक ये सीजन 1 का एक रिपीट क्वेश्चन है. देयर इज अ पाई रैन जा पीन. सो पायरेंजेपिन, पायरेंजेपिन, टिलेंजेपिन क्या है? पायरेंजेपिन, टिलेंजेपिन क्या है? इट्स अ M1 एंटागोनिस्ट. डू वी यूज इट इन आवर कंट्री? इट्स नॉट अवेलेबल इन आवर कंट्री. M1 एंटागोनिस्ट है ना, M1 रिसेप्टर पे काम करता है. M1 रिसेप्टर, M1 रिसेप्टर अगेन रिमेंबर गाइस, M1 रिसेप्टर का एंटागोनिस्ट है. M1 रिसेप्टर दे आर ऑल गोइंग टू एक्ट वाया GQ ना, GQ कपल्ड, ठीक है. एक ये वाला ट्राई करिए, ये वाला अच्छा है. ये नंबर्स इग्नोर करिएगा. आई थिंक वी हैव ऑलरेडी डिस्कस अराउंड मोर और लेस अराउंड 18 to 20. सो गेस द ड्रग ऑन द बेस ऑफ द स्माइली एंड चूज द रिसेप्टर ऑन विच दे वर्क. ठीक है. ऑन दिस ब्यूटिफुल गर्ल इज डांसिंग. There is a set and then there is a run, है ना? Very good. So I am actually talking about Ondansetron. Ondansetron, it's a 5-HT3 receptor antagonist. It's a drug of choice in nausea and vomiting, drug of choice in chemo-induced nausea and vomiting. ये chemo-induced वाला तो अभी recently 2021 NEET PG में भी पूछा, 2020 FMGE में भी पूछा. ठीक है, Ondansetron. Last question I believe. ये सारे के सारे बोनस थे. बट ऑन संडेज विल ट्राई टू कवर सम मोर ड्रग लाइक दिस. सो आइडेंटिफाई दिस ड्रग, आइडेंटिफाई दिस ड्रग ऑन द बेस ऑफ द स्माइली. जलेबी भाई, वेरी गुड, एक्सेलेंट. डॉक्टर कोई भी यूज कर सकते हैं, नॉट नेसेसरी ऑन्डेंसेट्रॉन. ये पूरे क्लास ये ना, ये 5-HT3 एंटागोनिस्ट हैं. वो ऑप्शन में आपके पेरानोसेट्रॉन था, आपके एग्जाम में पेरानोसेट्रॉन था, बट ऐसा नहीं कि ऑन्डेंसेट्रॉन अगर रहेगा तो आप नहीं चुनोगे ना. ऑन्डेंसेट्रॉन, ग्रैनीसेट्रॉन, पेलानोसेट्रॉन, डोलासेट्रॉन, ये सारे के सारे सेम मैकेनिज्म से काम करते हैं. ठीक है. वन ऑफ द ग्लाइसिसाइक्लिन, वेरी गुड सैनवास. द ओनली वन ड्रग अंडर ग्लाइसिसाइक्लिन इज योर टीगेसाइक्लिन. टीगेसाइक्लिन, इट इज वन ऑफ द congener or no, one of the congener or analog of minocycline, one of the tetracycline. Okay, tetracycline है, minocycline उसी का congener है ये. ठीक है, cycline. It can be used in multiple condition including VRSA, vancomycin resistant staph aureus, MRSA, methicillin resistant staph aureus, and they are also safe in renal failure patient. Why it is safe in renal failure? They are mainly excreted via the hepatic route. They are mainly excreted via the hepatic route, like है ना, doxy and this tigecycline, they both are excreted by the hepatic route. Okay, remember that. So what are they? कौन से क्लास में आएगा? Glycylcycline. D is the correct answer, है ना. Tiger and cycline, so tigecycline, है ना, tiger हो गया और ये cycling हुआ tigecycline. Yeah. So this was the last question. which I wanted to actually discuss for all the students those who joined late. एक बार जल्दी से मैं बता दे रहा हूँ. This will be Tigecycline, tiger or cycling. Then in this one we have discussed Ondan. Then there is a set, है ना, जो geometrical set होता है. And then there is a run. Ondansetron 5-3 antagonist. Pyranzapine. This was pretty simple one. Then Topiram and 8. So Topiramate, and anti-obesity, and used in 5 different areas as well. Mechanism of action. So what I wanted to show you, Tiagabine, T, AG or Mr. Bean. So Tiagabine, Sim, there's a VAS, Simvastatin, anti-dyslipidemic drug, HMG co-reductase inhibitor. There's a Pilocar and Pin. So Pilocarpine, anti-glaucoma drug. लव टायर्ड और टायर्ड है ना, दोनों है देखिए. सो लेवेटिरासिटैम, सी है ना, ICU लेवेटिरा, एंड देयर इज अ टी एंड देयर इज अ आर्म, लेवेटिरासिटैम एंटी एपिलेप्टिक ड्रग है ना, SV2A इनहिबिटर. देन रैम आई प्रे एंड इल, रैमिप्रिल एंटी हाइपरटेंसिव एजेंट. विनक्राइएंटिन, विनक्रिस्टीन. हार्ट फेलियर में डॉव, बूट एंड माइन, सो डोब्यूटामीन. And protease inhibitor, so Nelfinavir is the detergent, and Veer is the soldier, so Nelfinavir. And we are having here a car, Vedas, Vedas, and I and LOL, so Carvedilol, LOL वाले जितने हैं. Adenosine is very simple one, Adenosine pretty simple. Candesartan and tan, so Candesartan. And then they have given an OT here, Tio, rope and opium, बहुत clearly है. So this is Tiotropium. Then there is a Mira, one smiley is begging and one is running, so Mira, beg and run, Mirabegron. Alright, so this was everything which I wanted to discuss in our today's session. I hope you guys have enjoyed the session, and remember, it was just a fun filled session yet informative. So आपका जो आधे घंटे 40 minutes में लिया, we have revised a couple of drugs, and a similar kind of session we can also explore on the upcoming Sundays also. If you guys like it, definitely we can discuss it. Yes, Brivaracetam is also SV2A inhibitor, that is correct. Okay, thank you very much guys, have a good night to all of you. I'll see you in the upcoming classes that we have. Thank you doctors. Any question? चलो once again, ये बस आपके ना रिलैक्सेशन के लिए, बट स्टिल थोड़ा बहुत हमने रिवाइज भी किया ड्रग्स को. I'll see you in the upcoming classes. Thank you very much. Have a good night to all of you.